I'm here with the beautiful Dr. Lili at Skin Renewal, and we are going to talk all about fillers, what they do, where we use them, and also the myths around fillers. So, Dr. Lili, please just tell us before we start a little bit more about yourself.
So I'm Dr. Lili, aka the Glam Doc, and I have been with Skin Renewal since my Mrs. South Africa days in 2016, 2017.
Wow. Yeah, I remember those days. You were beautiful, absolutely beautiful.
Oh, thank
and
you.
you ended up in the top 3.
I did. I was second princess at that year, and we had a very long reign because they changed the schedule for Mrs. SA. So our reign was quite protracted. So we had a really long time as a finalist and then a really long time as a title holder, which was quite awesome, actually.
Yeah, because it is a special time.
It was great.
But doctor, please tell us what the different types of fillers are, because I can see here's quite a few, but what are they for?
So this is showcasing our Revenesse range, which is exclusive to Skin Renewal South Africa. So we are the sole importers into the country. And Revenesse has got a beautiful product profile. So filler firstly is created from molecules of hyaluronic acid. They mimic the human hyaluronic acid in your skin as far as possible. Where Revenesse is special is their molecule is spherical. So there's much less irritation, very, very low swelling factor when you inject it. And hyaluronic acid's job in the body is to suck in water and plump up like a sponge. So it's a hydrator. Okay?
Yes.
When we're babies, we've got lots and lots of hyaluronic acid inside our skin, and that's why our skin is so dewy and so beautiful. It's not the baby fat, it's actually just full of water. And as we get older, that hyaluronic acid content drops off. And that's part of the volume loss that happens when we age, as well as at a deeper level at the fat level. And then, of course, we also lose volume at a bony level. So fillers are designed to work in those different layers. So hydration in the skin, that's where we're using a product like Revenesse Pure, which is not on this wall, but that's a very, very loosely bound hyaluronic acid that we inject very high up, which is more of a hydration. It's not really a volume or a shape changer. And then these guys, we would be injecting more at a fat level and at a bony level. And you can kind of see on the diagram roughly the colors of the boxes more or less correspond to where we would inject them in the different regions in the face. And you need different compounds for different parts of the face. So you can't inject this guy everywhere. Okay, that's not going to work. This is designed for an area that's very mobile. It needs to work with you. It needs to fold. It needs to move. It needs to be flexible. Whereas something like an Ultra, for instance, or even a Shape, we put that deep down onto a bony level where we need more structure, where we need things to say kind of more solid for a longer time. Okay, so it's really important that your injector has a good toolbox to work with. There's no point in going in and you've got one filler and you're going to inject it everywhere in your face. That's not going to work. You need a specialized compound for special parts of the face. And every now and again, there's a little bit of overlap, but it's really important to make sure that those things are discrete. You know, different functions, different purposes, different results. And the most important thing to remember about fillers, and please guys, this is really the most important thing, they are not there to take your face from one looking thing to a completely different looking person. They are there to provide structural support at a bony and at a fat level and to refresh. Okay, so you should still look like yourself, just a more refreshed version. It's about injecting very small amounts of fillers in very strategic points of the face to rehabilitate or
enhance.
replenish.
Okay.
It's not the same thing or the same result as an invasive plastic surgery procedure. So please don't come into the doctor's office expecting those kinds of results. That is not what these guys are for. Okay. Used judiciously, beautiful results. Small amounts in very strategic places, as I said. Creating small changes that are even hardly perceptible. Great result. If you're walking out of here looking like somebody totally different.
Yeah.
Or somebody very puffy. We've not done well there.
Yeah, that is not what you want. And we've seen that. We've seen people walking in the streets and you can immediately say, she had filler. And that's exactly what we don't want.
Exactly. So if someone can't tell, if someone came to you and said, Talita, you look so refreshed, like you've been on holiday, what have you been doing? Can't really put their finger on it. Job done.
Well done.
If you're walking out of here and you're going, oh my goodness, you look like a totally different person, that's not well done aesthetics at all.
And how long does the effect last? Because now, say for instance, someone had got filler in and it looks terrible, too much. How long does it last? How long does that effect last?
So fillers in general, we say come in for a top up or a check in about 1.5 to 2 years.
Okay.
But, that's a big but. We can see fillers in the tissues up to 13, 14 years later on a CT scan. So this product doesn't disappear completely. Your body doesn't break it down and it just, metabolize it. That product is still sitting there. What happens is this behavior starts to change. So when we inject it in the beginning, it's in a nice little discrete clump.
Yes.
However, over the years, it's going to spread out like a blanket, like a duvet.
Okay.
That spread is controlled depending on what compound you've used. But, it's to varying degrees. And that is where the mistake is being made. Is you're going in for an injectable every year or every 1.5 or maybe even every 2 years and it's too fast.
Okay.
So what's happening is you're adding to existing product. You're not replacing it. And that's where a lot of people come short. That's how we end up overnight, seemingly, looking very puffy.
Yeah. And the one cheek is here and the other one is not because it distributed differently. And because now they're filling up. And then you get this.
Yeah, so even there, that could have been the injector in the first place, or it could be because you use your muscles on the different sides of your face differently. I am stronger on my left than I am on my right. I can raise my left eyebrow voluntarily, but not my right. So you will move that product differently over the years. So yes, of course, you can end up with asymmetry, but it could have been the injector in the first place.
And what are the myths around fillers? I mean, there's so many people walking around that's so scared to go and use fillers, but what are the main myths around fillers?
So I think, there's always risk with every procedure you do, surgical or non-surgical, and those risks are real.
Yes.
And that is a legitimate concern.
True.
However, I think where the whole misconception about fillers comes in is people are using their examples from crazy TV shows where the extreme is chosen to represent the average injectable patient. So we're getting these people coming in, with these very extreme, crazy results. And that is people's idea of what an injectable is about.
Yes.
And that is not, that is the biggest myth. Okay, they should be, as I said, almost imperceptible changes. They should be small, subtle changes.
Subtle changes, yes. Doctor, and with the hyaluronic acid, I know there's quite a few different filler types, but does it also depend how fast your body's metabolism is with hyaluronic acid, also for how long it's going to last? Does that have an impact?
Yes and no, but it's more to do with have you chosen the correct product for the correct region or part of the face that you're trying to inject? And how does that product behave? So I think it's more got to do with the actual product choice.
Yes.
If you've chosen the right thing, it's going to have longevity. And then it also depends, has your injector actually put it in the right plane? So if you've injected the right product in the wrong plane, it's not going to achieve what it needs to over time.
What makes this Revenus different from going to another skincare clinic and they're using another product?
So we do stock other types of fillers. This is just our filler of preference.
Of choice, yes.
And it's got a lot to do with that shape of that molecule, that spherical molecule, because it's got so much less inflammatory reaction post-injection, which means less downtime for you, less swelling, and therefore less adverse or unwanted reactions
Yeah.
post procedure. The usual risks still apply, but we've chosen this particular brand of fillers because of its safety profile. We're so fastidious about safety and protocol. This seems to fit in with our ethos a lot better, and it's a beautifully behaving product.
Yeah. How long did you guys test it? Because I know Skin Renewal is very particular when they test and try something new before they actually do it on a patient.
So Dr. Maureen has actually been looking at this series of fillers for about 10 years.
Wow.
And we've had it on board for I think about a year and a half now, maybe 2. And before that, we probably played around and tested with it for a good 12 to 18 months.
Sure.
Before it even becomes available to you.
To us,
You know us, we
Yes.
put things through their paces in the background.
Yes, but that's great. That's wonderful news, because that makes us trust you, because this product has been tried and tested for many years, if I can say many years. So we know you as a doctor knows what you're doing. You know the product. We can trust you.
Of course, always.
And then there's also a question of what is the difference between Botox and fillers? We know the difference, but there might be some people out there that don't know.
So also a common myth, or it's a myth conception, but
Yes.
it could be labeled a myth.
Yeah.
Fillers add volume. So they are jellies made of hyaluronic acid. They are placed either into the skin layer, in the fat layer, or deep down on a bony layer. They add volume, they hydrate, they change shapes, they contour. Botox, or a neurotoxin,
Yes.
works on muscles. Muscles contract and relax, and every time they do that, they are folding the skin that is sitting on top of it, and that is what is producing the line on your skin. And we inject that into a muscle
Yes.
in order to relax it. When the muscle is not actively contracting, it can't fold the skin that's sitting on top of it, and therefore the line appears to smooth out on the skin.
Yes.
Sometimes it's a little late. Sometimes the line is too entrenched in the skin, and
Yes.
it's not possible to only eliminate that by relaxing the muscle. We need to get other things on board, but they have two very separate functions and very separate outcomes.
Yeah. But you can use the two together.
You can. So you obviously they've got different indications, and
Yes.
you cannot inject a neurotoxin anywhere in the face. There's certain areas of the face that are amenable to that treatment.
Yeah.
You have to move to function in a 3D world. I cannot immobilize everything.
No.
You are not a photograph.
You're not a robot.
You're not a robot. You are a walking, talking human being. You need to function. So we can inject it strategically in points of the face to just alleviate some of what you perceive are the negative aspects of your expression.
Yeah.
But at the end of the day, you need to function.
Yeah, you need to function. You still need to have some sort of a expression. I mean, we still want people to smile at you and not look at you like blank face, because you've got a blank face.
You can't. Well, if you Botox or if you toxined everything, you wouldn't be able to move.
remove anything. Oh, thank you, doctor. And tell me, if there's clients out there that want to come for fillers or Botox, what would your recommendation be for them?
I definitely say start with a consultation first, get properly assessed. A lot of patients come in thinking or wanting something that they actually really don't need, or perhaps we identify something different for what you thought you needed. So we really need to assess properly. We need to be on the same page with your injector, and you need to develop a realistic set of outcomes when you come in, so that we can create a result that favors both you and us.
Yes.
And we definitely don't do extremes.
No, you don't do extremes. I mean, I've been here with Skin Renewal for many, many years, and there's no extremes. It's all about being yourself, realistic results. And I think that's also where the customers need to understand. If they come for a consultation, they need to be honest, and they need to also know that they're not going to walk out here a different person.
Yeah, it's also difficult for a healthcare provider or for an injector to deliver that news sometimes. You know, sometimes a patient will come in, they're insistent, they want something. And as an injector, you know that's not going to serve you. You're going to end up looking very strange afterwards. And so I'm not
It's
going
a
to say
guide.
deny
Yeah.
a treatment, but guide you in a better direction so that you have a much more natural looking result.
Yes. Yeah.
So be open to that, because
It's an open discussion.
you may have one idea, but we come in and we just know it's not going to end well.
Yeah.
Please trust us.
You also want the best for your clients.
Exactly. I want you to walk out of here being the best version of you, or a refreshed version of you.
Yes.
I don't want to create a very unnatural looking face. And thank goodness the trends are moving towards more natural looking. Thank goodness. I'm very excited about that, because I've never been one to create that kind of extreme weird looking result.
Yeah. No, but thank you so much, Dr. Lili, for being here today and for talking to us. I really appreciate it, and thank you for discussing everything about fillers today.
My pleasure.
Thank you for our episode of Tea with Tea. Please remember to go and like, share, and follow all of our social media pages, and go and book your skin consultation with Skin Renewal. See you soon.